IG version, we need to know basic fundamentals of the document. These fundamentals, however, what I'm showing you is a 3.4, but you can also get our similar observations. Of course, there is a SDTM IG differences across different domains, different domains and different versions. But whatever I am going to talk now has some potential importance across all versions. So remember in the 3.4 particular classification is not given, but of course there are broad level they divided the classification, and the page in the page summary page they are not given, but in the SDTM IG 3.2 version page number 14 it is clearly mentioned the what are the domains present in a particular domain, and I will try to show at the end of our class the classification and what actually we need to know or understand about the domain. So just I am taking example substance use. Why I am taking this example? There is no particular reason, first of all, because any domain, the quality or the value it is going to enter, it is going to change, but the basic fundamentals of the data should not change. Fundamentals, I am talking about the variable name, label, type, control terminology, role, series node, score. If you see in whole this 461 document, if this study ID is talking as a unique identifier for a study, means it is not dominated or not overwritten by with any other variable. This is a unique variable and this is the only variable talk about the study ID across all domains. It's a irrespective of therapeutic area. Remember, this is very important point. For example, in a domain, if you are targeting, there are 25 variables. In the 25 variables, study ID is a one of the variable. And another domain, if you take in that 30 variables are present, means by default, if you have clarity on the study ID, automatically in another domain, the study ID definition is remain same. And if you are following one derivation for that study ID, you can follow the same derivation for other domains. This is very important. And within a therapeutic area, within a particular protocol, study ID value will not change. For example, if I am doing a work, let's say example, consider study ID is ABC1234, and the ABC and 1234 are separated by slash or some without separated slash, means slash means I mean to say dash. Okay, this value will not change or not change within a study. Remember, why we need to know? The principle applies similar. And another basic fundamental is all SDTM domains contains two letters. Of course, you might be knowing already. Only supplementary domains we will try to keep as a initially we will try to keep SU, PP followed by prefix. This is another important point. And of course, we will to understand this domain, I recommend first read label. Okay, if you understand about the label properly, at least if you guess based on your knowledge, you will understand. After the label, try to read the CDISC notes. Once you read the CDISC notes, then you try to read the role so that you will understand what type of that variable and what is its importance obviously it is very difficult as if first time if you are reading as per my recommendations. If you are reading domain abbreviation, if you read it is a 2 characters and you will read as an identifier. Some variables, these are pretty much straightforward, but few variables, definitely it is very hard to predict. Simply you can go here down. First you check the data. So you understand about the data. For example, if I'm talking 3.4 and it is SU substance use data, you can see one variable called SUTRT or any topic variable of the particular domain. If you see cigarettes, coffee, cigarettes, tea, coffee, cigarettes, caffeine, all these are related to substance. That's why we are presenting in the substance. You can ask me a question, can I present this domain or this data in any other domain? Correct? That is a basic question. If you see, if you give an option to select one, you will choose only one. But if we have like 50 options, obviously based on the experience or based on the knowledge or based on the discussion outcome, we will try to keep a select the things. Same thing here also. When you see something data, why this data should be present here? Why can't be present in other domain? Of course, the domain name you don't know, but why can't keep? It is a fresher, everybody gets the same question. So, for this, we need to know about the CRF, case report form. It is a blueprint of data, and every CRF form designed with a title. The title clearly says one name about the substance. When the data is migrating from the database, there are few databases present. When the databases, metadata or Rave, some databases are there, when the data moves or extracted from the database to Excel, Excel to raw data sets, and the SAS programmer convert them into your raw data sets, that is as per the SDTM standards. Remember few variables. Okay, it is very understandable that cigarettes and its category, tobacco, caffeine, all these are pretty much standard based on the 1 to 2 years experience or based on the continuous reading and based on the variable definition and something, we can create particular data set. Okay, again in this, we will get a question. When I have 50 domains, which domain I should start? Which domain I should not touch? Which domain not at all required for the particular study? Agree? So these questions will be discussed as part of the study, meetings, when it takes a responsibility by the lead programmer and when he is giving the assignments, and also the subsequent analysis data sets based on that. Few data sets will be created. Usually in the interview question also they will ask on which basis you will create these data sets. The fundamental answer usually say the sponsor as per the standard requirement. Of course it is a sponsor requirement, but whatever the statistician wants the outputs, for that only we will try to create a SDTM data sets. And of course there are a lot of some limitations are there, some discussions are there, some data sets will be generated neck of the movement based on the requirements. Some of the data sets initially they will think, but due to the data availability or due to XYZ reasons, they will not try to develop. But Never assume that in a particular situation, particular company, for particular study, protocol, they are not going to develop all these 50 domains, 50 plus domains. There will be choosy domains, demographics domains, that is a pillar domain and required some basic fundamentals, and the variables required to use some other data sets to use or create the additional variables. For that only we try to use the demographics. And there will be another question, okay, based on the study ID, domain name, and another easy point to discuss is the domain. If I'm talking LB domain, you can see value LB. If I'm talking about the substance use, you can use SCU. You can, if I am trying to talk on the vital signs, you can expect to see vital signs. So, for all records can be one number to infinitive number. Of course, infinitive number in the sense more and more numbers. Sometimes you can see 1 lakh records, sometimes you see 20 lakhs records if the study is going. For all that records, whether 10,000 or 20,000 or 1 lakh records, the definition of that particular variable is remains same. It will not change. Only what will change? The value change based on the subject movement during the clinical study. But remember here, the logic used to derive that particular variable should be similar. It should not be depending on the person. Of course, depending on the data flow, not on the particular person. If a program is written based on the particular person, that is called hard coding. No company allows to write a hard coding program. Remember, that is very, very, very important. And the variables like study ID, domain, unique subject ID, of course, some derivation is different, defined, important, sequence, treatment, category. And also if you closely look here, for the study ID, all the variable values are present for particular subjects, unique subject IDs. We have 1, 2, 3 unique subject IDs is present. For these 3 members, study ID is completely present, domain is present, and sequence present, treatment present, category is present, but some of the values are missing here. Is the missing of the values is because of the non-data availability, or due to the human error the data is not available, or we don't know. So it is very pretty hard to predict, correct? So remember that. How whether particular variable should contains the values or not, it depends on the core variable. When the core tells required, there is no compromise. The variable value should be present. If someone tells the data is not present, the data is not, I don't know, the data is not there. No way, we need to get the data. SDTM tells when the variable you are defining as a required, the value should not missing. You need to check with a clinical data manager. The value is missing due to XYZ reason. What is the reason? I would like to know, or team want to know. For example, if you see substance use, the domain, study identifier, domain, unique subject ID, SU sequence, and we see any required variables. You see, don't. So, any domain, if you see they are required, means required. Whether if the data set contains one observation, though that variable should contain required values. appropriate values. When you see here, another value, permissible variable. Of course, we have another core category is EXP. EXP is expected. So we discuss first for permissible variable, and another data set we will discuss about the expected. What is the permissible? Permissible variable means, of course, this required variable and you check this role variable. Okay. This is a required variable in the data set, but this variable useful to identify that some information in the data. For example, if you see study ID is a required variable, and by seeing the value of that variable value, we can identify what type of study or what is the study number. What? We can identify what is the study number. Means if the study value, if you see ABC 123, okay, it is a study of the ABC 123. If some XYZ, you can imagine that it is XYZ. Nothing to do with what is the study design or something. For that moment, you know that is a study related. Coming to the permissible here, again in this required, you have some different types. Topic variable, we will discuss here. Then we will go to the permissible. What is the topic variable? Today's topic I am discussing on the SDTM. Previously we discussed about the clinical trials design. Before that we discussed about a lot of very important points. We discussed about the interview questions, we discussed about the 500 questions, and we are going to discuss few more questions. We are going to discuss about the ADaMs, we are going to the TLFS. So what is the called topic? Same thing here. In the substance domain, you are going to topic variable. It is a very, for the freshers, when the people will get a job, they may see some data about the substance use of the subject during the clinical studies. How to identify? There are 50 domains and some of the values are almost similar to same. Out of this form, they know what are the data sets present, they know what are the tables present, they know mark shells present, everything, but from which data set the data should be take. So remember, important point is, first check the title of the mark shell, what are the content, I can say, as a body of the table, then observe the value in the body, then come into the SDTM IG, and of course if you have experience, definitely you will identify. Otherwise, check the value given in the assumptions. Compare the assumption values or take the inputs from the lead manager. To understand the table, to understanding of the variables with the labels are important. And if I am talking substance use treatment, means that is the topic, means a person during the clinical study, if he is taking other than the study treatment, other than concomitant medication, means any medications, whatever he take other than this, that information will come to the substance use. Remember here, which information should be goes here. It is very important to discuss with the lead programmer, or lead programmer will, based on his knowledge, share to the team which information. Remember, there is no small question and big question, or non-known question, known question. If it is a vital and important, the question should be asked to get more clarification with your lead manager. This topic variable for the substance use is as mentioned, cigarettes, caffeine. For an adverse event, ADaM. For the laboratory or findings domain, there is a LB test code. For the vital signs, VS test code. Like this, different variables present. For these different variables, different values present. So, when the table assignment happens, always go and check the contents of the table which you know in your company, which path, which fold you need to check. And based on the core, variables are classified into required, expected, permissible. But based on the role, the variables are classified into 5 types: required, expected, quitter, qualifier, identifier, timing, synonym, qualifier, like this. Again qualifiers, again they are differentiated. We can see the differentiations and definitions once we will get at least basic understanding on the data. And also if you see here, there is a text called permissible. PER means permissible. What is this permissible? Permissible value, variable. Remember here, I am talking about the variable. This variable can exist or not required to exist in a particular data set. Even this variable is created, the values can be missing for all observations or can be present here and there. But when the required variable is present, the variables should be present, the value should be present without any missing. But when it is expected is present, when the situation demands, when the situation demands, the value should be present at particular variable. Okay, value should be present for that variable. Otherwise, it is a data issue. The usually data issues are controlled or to be discussed with the clinical data managers. They are the responsible to provide the quality of the data. What? Quality of the data to the SAS programmers. And when this clinical data manager, of course, they cannot or they may not maintain the or they can't update the data. They will check with the clinical site people. Clinical site people usually they will cross check the data in the database and confirm to the data manager. Again, data managers will inform to the statistical programmers or SAS programmers, and if he is not satisfied with the answer, they will again check or it will be discussed through the meetings and other things. Again here important point, if you see here, not only the variables, some values you see numeric value, some value you see character value, again some you see the date and time value. So data also divided into 2 types. One is the character type data. You see here character type data, and most of the SDTM variables are character data type data. Of course, some variables, substance use, consumption, it is a numeric variable. It might be tells about the quantity, 1 or 2 or 3, like that. But in the SDTM, most of the data is a character data. Usually we don't create a more numeric variables. We create only character variables. And this for these character variables, okay, for these character variables, these new variables will be created. What? Sorry, new variables will be created as a numeric variables in the ADaM level. Okay, the ADaM level. Okay, next. When you see here, there is a control terminology column. What is this? Control terminology. What is this control terminology? Means SDTM tells that for this variable domain in the substance use, previously I said study ID is similar for all the values, but the blank is filled here. Company who is the sponsor will decide, or lead programmers will provide the study ID. Of course, if you read the protocol, basically you will understand. But what about the domain? See, classification as per the control terminology. CDISC has provided to use this substance use. All of a sudden, they created a domain and they want to use this particular that classification. We should follow that in that particular version. You cannot replace that value. Only wherever the values you see they are missing, but that it is as per the study requirement and the CDISC notes requirement, we fill the gaps. Otherwise, whatever the value provided by the control terminology, sometimes domain you see only one value, so it should be followed. But if you see here SURSP substance use pre-specified, you can use N or Y. This is called as a code list. You can use N or Y. Might be, I will show you some other variables in another domain. Mainly we'll go to, for example, if you see not only values, this is the one of the interview question asked by the interviewer. There is a country, okay, age should be here. Demographic, subject, birth date, IS 8601 format, race, okay, arm, DMDSC, and CF, country. And what is the format here? ISO 31661 format. And this country format should be as per this. So, and also there is a requirement from the USFDA as per this example. What is that requirement? If you see, the values should be, let's see, the values should be, you see, only 3 letters, characters. We see here. See here, 3 letters, characters. If we want to abbreviation, we will convert this data into abbreviation manner in the ADaM data sets, not in the SDTM. In the SDTM, it will be same. Not only by you, whoever follows the SDTM, by default, they should keep this text only. Whether they want to fill the text or they want to not present the data or they want to combination of the character or numeric or they want to keep the character or only numeric, all this will be decided by this document. Okay, and if you see another example, pretty much standard example, sex value, what you can see here, male and female. If you want full text, you can convert this variable create with a sex variable in your ADaM with a sex SEX as a column. But in the SDTM, you want to read this data, you will see this data only M or F. And certain variables like demographic variables you can see only in their demographics data set. These data sets, variables, if you want to combine with other data sets, like SAS, we will use right or left join to get that variable into the another data set. And in other way, during the development of ADaM data sets, we will try to combine the data and with a left or right match, and then we'll create the data set. Okay, clear? And every variable, every variable basic definition, I said just now, it all depends on the CDISC nodes. There is no alternative to the CDISC nodes. Of course, there is a more explanation based on the experience or based on the repeated meaning or based on the assumption, it will be decided. But that is a very standard definition and assumption to understand. You are not required to keep capital F to small f in another study, or you cannot replace with the full text of email, because if you do like that, Pinnacle 21 application will not accept it, will throw errors or warnings. Usually the reviewers will expect the reason for that. So in the SDTM, we will try to follow the things what they said. There is no compromise or there is no additional information. Additional in the sense, we will not compromise the definition and write something different. There are some hundreds of control terminologies are there. For example, frequency. For example, route. You can see here oral route. Oral route, we have different routes. Oral route, topical route, sublingual route, like that. You cannot change. It is as per the your convenient. It should be as per the control terminology convenient. Otherwise, Pinnacle 21 will go as a throw error. Remember here, or I am recapping the information what we discussed. All SDTM IG variables are pretty much standard. Every variable based on its importance, either it is divided into core or role. In the core, you can see required, expected, permissible. In the role, you will see 5 types main. Again, the qualifier domain is divided into different qualification. There should not be any value without variable name. Of course, it can't. It will not exist like that. Every variable is a question in the CRF, and every variable can be typed, whether it is a character or numeric type, and every variable value is filled based on the control terminology. If the variable is a timing variable, based on we will try to present as a timing variable. And pretty much when the lead programmer or senior persons make the specification, he will try to keep the same columns almost. Of course, it is company requirement to keep the role or core, but pretty much name, label, type, control terminology, instead of CDISC nodes, they will present derivation or something. These are pretty much standard. What? These are pretty much standard. And every value should be decided for a particular subject by a structure. This is called structure. And the structure determines and tells about what type of the data should go. For example, if you see one record per recorded intervention occurred per subject means if that event that occurrence or some record you are seeing based on the particular observation for particular subject only on that occurrence means if that occurrence is happened on the based on the date and time around 10:30 a.m., that occurrence happened to the subject at 10:30, even that it won't include at 10:31 a.m. time. It includes only 10:30. There is no compromise of 30 seconds, 1 second. It should be documented as such. No data. As per the regulatory, we should not delete any data. Data should be present, but programmatically, logic way, we need to select the records. To select particular record, in the ADaM datasets, we will try to create a variable called analysis01 flag. So for example, in the SDTM, we are telling it is a standard and every data we should not remove and everything is important. But really some data is not important. So you cannot make a program for every data, correct? So in the ADaM level, for a required variable or for particular required values, we will try to create additional variables. For example, in the SDTM domain, for example, in a particular domain contains 30 variables. In the ADS, in the ADaM data set level, you can create a ADaM data and you can create similar number of variables or more than that or one or two variables. That is determined based on the mock shell document mainly. And you cannot change the variable labels also. Of course, you can give the explanation, but the expected is you should not change the variable labels also. So what we understood, the structure is important, the label important, variable important, label is important, type is important, control terminology, road, everything is important. Means yes, everything is important, but we need to the standard. And if you read one variable for particular classification, automatically it similar data and definitions you can apply. Of course, it definitely to be checked by the lead programmers and based on his knowledge whether that value can be kept or not during the derivation. And if you read first 62 pages in the 3.4 version or first 32 for 52, 57 to 58 pages in 3.2 version, if you read, it gives a lot of information about other domains or other fundamental definitions, whether that particular variable should be present, absent. If it is present, what type of values should be present. For example, test code more than 8 characters. For example, variable label more than not 40 characters. Variable name not more than 8 characters. You should not special characters in the data. When the data set should be splitted into separate data sets. If they want to split, on which basis it can be split, what type of visit information it will be filled, what is the definition of the variable, what is the planned variable, what is the actual variable, what are the data present for the subjects, what type of data should present in the trial data domain data sets, what are the annexures present, what are the abbreviations present, how one data should be defined, what type of data should be present, what not to be present, what is the variable, why this variable, and why can't the same variable under the similar classification, why this should be unique, why this should not be unique, what is your understanding if the assumption is wrong, what is the explanation you can expect, and who is worked on that. Like this information is clearly mentioned in the SDTM IG, and every SDTM IG will be updated based on the experience for the better quality and the safety of the human life. And read this document definitely without missing.